I'd like to recognize Janet Kinney, CEO of Calhoun Liberty Hospital, Dane Eagle, Executive Director, Florida Department of Economic Opportunity, Jared Moskowitz, Director, Florida Division of Emergency Management, and Jason Schoaf, Representative, Florida's 7th House District. Thank you all for coming. Before I begin, I just want to say that the people of Florida stand ready to support our friends in Texas and Louisiana who are facing Hurricane Delta as we speak. And in fact, the places in Louisiana just recently had a hurricane not too long ago. So we're praying for everybody in the storm's path. Tomorrow will mark the 2-year anniversary of Hurricane Michael's landfall here in Northwest Florida as a Category 5 storm, one of very few number of Category 5 storms to make landfall in the United States, and the only one in Florida since Hurricane Andrew in 1992. The storm brought powerful 160-mile-an-hour winds and devastating storm surge, estimated to be as high as 14 feet along the coast. Here at Liberty Calhoun Hospital, Hurricane Michael's devastation is still evident. The hospital, like many homes and like many businesses in Northwest Florida, was nearly destroyed. It lost 80% of its roof and 15 of its 25 beds. Given its location, the hospital is deemed a critical access hospital by the Centers for Medicare and Medicaid Services, and it primarily serves low and moderate income populations from Calhoun, Liberty, Jackson, and Gulf counties. Well, this hospital does not have beds surrounding residents are forced, when this hospital does not have beds surrounding residents are forced to travel 50 or 60 miles to receive emergency care. So the hospital also provides economic support for the area with good jobs in the medical field that would otherwise be unavailable. So we obviously have a responsibility to help the hospital. Community needs it, and we need it back at full operation. And so to that end, I'm pleased to announce today that the Department of Economic Opportunity is allocating $10 million from its long-term recovery funds to not only reconstruct the Liberty Calhoun Hospital, but to make sure that it's more resilient than ever before. And on my first day in office, first full day, we went to Bay County, make sure all the communities affected by Hurricane Michael knew that we would stand with them on the road to recovery, and we understood that that would not be days or weeks or months, but would take years, just given the damage. And we've been working hard to get as much money out as possible. So far, we've been getting the reimbursements out as quickly as has been done in recent history. We've paid out over $830 million in Hurricane Michael reimbursements, Bay County being the biggest recipient of that at over $380 million. We also secured during the 2019 legislative session $25 million in funding for a state grant program to help local governments fill budget gaps. We also set aside $115 million for affordable housing in the Hurricane Michael affected areas. Then this most recent legislative session, we secured an additional $38 million for recovery efforts, most of which was reserved for housing and for mortgage relief. We have also worked with the Department of Agriculture to begin administering $380 million in timber recovery funding. The DEM has already paid out $3.8 million to timber producers affected by Hurricane Michael. I'm also proud to have the First Lady with us here today, my wife Casey. She's focused on ensuring resources are more available to individuals still recovering from the mental health impacts of the storm and its aftermath. In fact, because of the First Lady's attention and her inspiration, the Department of Emergency Management hired their first ever mental health coordinator, who is tasked with going to communities pre and post disaster to help ensure mental health resources are available for those in need. We've also worked closely with the Trump administration, and we received a lot of great support, and so we're very thankful for that. So we think that this is a great announcement for the hospital, and we had planned on making the announcement, and we're glad to be here to do it. But we're also glad and happy to be able to say that we have just heard from FEMA today, and they've approved an additional $104.9 million obligation for Hurricane Michael relief. This includes more than $90 million for Washington County road projects and nearly $15 million for projects in Bay County, including road repairs in Springfield, a $12.9 million dredging program project in Mexico Beach. This project cleared the Mexico Beach Canal which is very important. Public access point for boats in the area was a priority of the mayor, and I'm proud we'd be able to work with FEMA to get this project obligated. Mexico Beach, many of you may not know, their annual budget is about $3.5 million. And so this is a big reimbursement and very, very important. So we're going to process payment for half of this project within the next week, and the rest we will pay out shortly thereafter. So we're happy to be here. We're going to continue to do it. I've told Jared Moskowitz when he started, we want to get money out. He's worked really hard to improve the state's processes. And now with Dane Eagle at DEO, I've told him as well, as we get this stuff, get it out. The money's going to be more impactful the quicker it's put on the street. So I'm going to let both of them come up and say a few words. So Jared, you want to start?
Thank you, Governor. It's good to be with the First Lady today. I want to thank the folks behind me, local elected officials who did so much in the aftermath of Hurricane Michael. You know, as the governor just announced, obviously, this additional obligation of the $100 million, these are projects, obviously, that were submitted, you know, a long time ago. So we're happy to get these dollars, and we'll work to make sure that we get them out as fast as possible. I know Mayor Al Cathy in Mexico Beach will be very happy to hear that the dredging project, which he's worked so hard on, has been obligated. And obviously the money for the road project in Washington County is going to be a huge difference. So we'll make sure that that gets done as soon as possible. You know, I want to thank the governor. You know, very early on, if you recall, you know, the governor went to Washington, D.C. to figure out what more we could do and got the president to approve 45 days at 100%. So the federal government picked up categories A and B. That's your debris removal and your emergency protective measures. The federal government paid 100% of that event. And that saved hundreds of millions of dollars, if not just state, but local taxpayer money. That was a huge deal. DOT came into the area and helped with debris removal and did almost $500 million worth of debris removal. In fact, as far as I know, other than Katrina, it's the largest debris removal project that's ever happened after a hurricane. And so, you know, that was a huge deal that the state stepped up and helped the locals with that. After that, the governor wasn't finished. The governor went back to the well, went back to the president, and then got an additional 90% for categories A and B to be paid for by the federal government, so that the state cost share and the local cost share was only 5% each, again saving tens of millions of dollars of local taxpayer money. You know, we realized, you know, when we took over the division in January that we had lost kind of our core mission, which is, you know, one of it is to get money out the door. This is not our money. We're returning local money to local governments that had to spend money in the event of a disaster. And so, you know, I'm happy to report not just the $832 million that we've done for Hurricane Michael, as the governor announced, but we've done $3 billion since January of 2019. It's the most amount of money the division has moved in that period of time by double. We also wanted to help out in different ways. So for the first time ever, the Division of Emergency Management picked up the sheriff's spending. You know, there was a ton of mutual aid that poured into this neighborhood. Everyone remembers it. All the mutual aid that came from all over the state. The sheriff's office has spent $7.5 million helping out first respond, you know, for being a first responder, being here on the ground in the immediate aftermath. And so we didn't want sheriff's offices to have to deal with the reimbursement process because it's important that their budgets, you know, remain whole. And so the division stepped up and took that responsibility on. We laid the money out for those sheriff's offices so that we could deal with reimbursement. The First Lady brought to our attention about the mental health needs, and she's done a tremendous amount of work. But her idea of a mental health coordinator, you know, we're the first Division of Emergency Management at the state level in the country to have a person specifically dedicated to coordinate all mental health efforts that the states have in all of our different departments. We know sometimes things get siloed. You know, not every agency knows what another agency is doing. And so her suggestion to have that mental health coordinator has really helped break through to make sure that those needs get down where they need to go. And so, you know, we worked very hard to make sure that we got that timber block grant I know, Senator behind me knows how important that is for that industry. It took a little while for Congress to send it to us, but we're already processing money faster than we did for the citrus block grant, and that was the fastest we had moved money, $250 million for the citrus block grant. So I'm very happy with the way the timber block grant is going, and I'm hopeful that it gets to those businesses. We know how important it is for the timber industry to get to those businesses, and so I'm happy to be here with my former colleague, Dane Eagle, now Executive Director of DEO, and the two of us will work together, to help the folks here recover after Hurricane Michael with, our mitigation money and the CDBG DR money that he has in his division. Governor, thank you.
Is this your public debut?
This is my public debut. I want to thank you all for being here, and thank you to the governor and the First Lady for your continued commitment to the people of the Panhandle and the recovery of Hurricane Michael. We're here at the eve of the anniversary of Hurricane Michael, and we've done a lot of great work. The local leaders standing behind us here, the governor and the First Lady, their administration. And while I'm new to this job, I'm in my fourth week, as the governor highlighted my public debut. I was working in the legislature, and he was clear from his leadership on day one as he assumed office, we need to focus on recovery. And now in this position, I'm glad to be able to do this. And he's exactly right. He said from day one in this position, my job is to help get that money out. This isn't our money. This isn't the federal government's money. This is taxpayers' money. And it does no good sitting in the government's coffers. So as that money is awarded and allocated to us, it's our duty to get it back into the hands of the locals so that they can rebuild stronger than ever before. So I'm glad to be able to be here today to talk about some of the efforts of the Department of Economic Opportunity under Governor DeSantis and First Lady DeSantis' leadership. The National Dislocated Worker Grant, DEO, has been awarded an additional $7.3 million in federal funding through the National Dislocated Worker Grant, and that provides Floridians temporary employment to assist with cleanup, recovery, and humanitarian efforts in areas impacted by Hurricane Michael. With this additional funding, that accounts for a total of $27 million that has been provided to local workforce development boards in the impacted communities. The Rural Infrastructure Fund Program, we've awarded more than $5.4 million in funding for infrastructure projects in 15 rural communities in Northwest Florida that were affected by Hurricane Michael. And obviously today we're here at the Liberty Calhoun Hospital. As the governor mentioned, 15 of 25 beds were lost. 80% of the roof was destroyed. Individuals had to travel 50 to 65 miles for health care. That's uncalled for. We can't stand for that. So very proud, as the governor said today, we're proud to announce through our state action plan that $10 million is going to be allocated towards these repairs. And we're working very closely with Secretary Carson at HUD and President Trump. They've agreed to help in process and try to expedite these funds. So look forward to future announcements on that. But we've got a lot more work to do. This is a great announcement for the residents and the locals today, the local community leaders who have been focused on this. I encourage everybody to visit rebuildflorida.gov for more details. We've got more announcements to come in the near future. As the governor said, let's get these monies back into the hands of the taxpayers. I look forward to working with all of you at the Department of Economic Opportunity, with Director Moskowitz in his capacity. And I thank the governor and the First Lady again for their commitment to rebuilding Florida stronger than ever before. Thank you all for the opportunity today. Thank you.
I also just want to thank Jared and all the folks in the state government, as well as the local folks, for the response to Hurricane Sally, and also to the Trump administration. They approved all of our requests and even approved our request for individual assistance, which I think will be a big help to a lot of those areas. We did see a lot of flooding in places like Escambia. Fortunately, we didn't see as much flooding in the aftermath with some of the rivers that we feared, but there's still damage, and I know some folks need that, so that'll be very, very helpful. And again, that one wobbled towards us. This one didn't make a break east, and so it looks like we're going to miss it even in the most farthest west of Florida. But we really need to be praying for the folks who are in the way, and we do stand ready to offer assistance as either Louisiana, Texas, or maybe Mississippi may need it. So thank you. Questions?
Governor, do you have any reaction to Judge Walker's decision about
So I figured that there would not be any relief granted. We started getting reports on, I guess it was Monday night, that there was some people were having trouble. So we looked, when did it start? Okay, 7 hours, let's do 7 hours. And we actually did it in a way that would have live in-person options the whole time too. You know, at 10 p.m. at night, and many people did get through, but at 10 p.m. at night, you can't just go to the DMV. We made sure those places were open. So I think we did the right thing, and I didn't really see there being much of a federal issue at this point. So I was not surprised by the ruling and believe we handled it appropriately.
Was the wording in this decision giving cause for concern about things that can be fixed in the future?
I have not had a chance to read it, so I'll have to do that and then take a look at it.
Governor, the president really recently extended the public health emergency declaration. I believe that would actually extend the handout path. What does that mean for just the current state budget?
Hundreds of millions of dollars for us. So we were very pleased to see that, and we have that, which is going to be helpful. We also have some of the more tobacco money, which I think the legislature, the leaders now and then coming, I think, you know, we really view that as something we can use on health expenses for next budget rather than put in the trust fund. So that's over $100 million as well. So that's a big help for us. And if you look, the revenues that have been coming into Florida are way higher than the expectations once the economy shut down, what people were projecting. So we've been able to beat it the last few months, and I know what they're collecting in October, I think has been, I think $200 million more than what they had thought that they would get. We obviously know that the country added jobs. We anticipate adding more jobs in Florida when that report comes out for us. And so those things are important to make sure that we're able to meet our obligations. I mean, obviously, we've got a lot of things that we got to be fiscally sound. We still have the AAA credit rating. All the agencies recognize we were taking the appropriate steps to maintain stability. So you got to do that. But we also want to continue, you know, supporting education, supporting environment, supporting public safety. So these are all very, very important things. But that Medicaid money will be helpful, and it relieves some of the burden off us. And look, I don't know what they're going to do on any type of coronavirus phase 4, but that obviously would be something that we would use if they do it. I think we've assumed we're not going to get it, and we've taken appropriate action, and we'll be able to handle it. But at the same time, I mean, if they're doing it, then that'll be something that we'll be watching.
Governor, another question about hospitals. So here's like 4 hospitals here saying that CARES Act is providing the flood money that help for patients. Look at the numbers. We're at a fraction of what we were cut. I don't know if you've been talking with Secretary or.
Well, is that because of the how they dated it for a spring outbreak?
That's one of them. There's that, and then there's based on revenue and price chance of money from U.S. teaching hospitals.
Well, yeah, no, we'll definitely look at that. I mean, the initial issue that we think is going to be fine, or I think it should be fine, was they basically did CARES, and this goes back, I mean, when they do the retrospective on this, I mean, the assumption was we had a nationwide outbreak in March, and that just isn't true. We had a Northeast outbreak. If you look at their epidemic curves, Connecticut, New Jersey, New York, Rhode Island, all the same. And so they basically said, well, once you get into June, then it doesn't matter. Well, lo and behold, every place in the southern latitude at the end of June, same cycles. Now, our cycles were not as severe, but they were still significant cycles. And it was all what happened. So it's totally unfair to not treat the folks in that group, not just Florida, but all these other states, the same as the other places. The reason why our outbreak was over the summer is just because the virus behaved differently in these latitudes. And I think you're seeing that now in Europe, where they had nothing over the summer. Now you're starting to see it. I mean, that's just the way this thing works. So they should do it. And you know, we want to be helpful. I also think that it's important to point out, as important as one of our main pillars was to make sure that our healthcare system had what they needed to be able to respond. The PPE, there was never a problem with the PPE, especially as we got into May. All that is flowing, all that is good. Obviously, they have the ability to test. The hospitals at the beginning of this, they had like no swabs. I mean, Jared and I were trying to get them. So all that stuff is good to go. And then obviously with the medications, we've worked really hard. They're now getting the remdesivir straight from the manufacturer. But we look forward to things like these antibody cocktails. Eli Lilly is going to get emergency use. So that's going to happen next month, where that's going to start coming. You also have the Regeneron that the president took. These things are really promising. I mean, we'll see how they work in the broader population, but the control groups, in terms of what they did, it's a really significant decline in terms of severity that I think is noticeable. So we want to make sure that those are getting down to where they need to go. But the system was more than adequate to handle the peak, which for Florida and I think Texas and Georgia and most of the places was about that third week of July. We had about 9,500 patients that were hospitalized and treated for COVID throughout the state of Florida. We've got about 65,000 licensed beds in the state of Florida. And so that was, about 15% or so, a little less than that of our total beds. Now we've had a big decline, and then we've basically entered a period where it's been relatively stable around that 2,100 patients statewide. So again, out of 65,000 licensed beds, that's about 3.5% of the licensed beds. So there's a lot of capacity out there. The capacity was never exhausted. Now I think we're about 590 COVID positive patients in the ICU. I think probably about 530 are actually being treated for COVID. I think 60 may be COVID positive but treated for something else. But either way, that's less than 10% of the current ICU beds, and obviously they can really surge those if they need it. I had a panel of experts from places like Harvard and Stanford medical schools a couple weeks ago, and I asked all three experts, do you believe that this epidemic will overwhelm hospitals at this point? And they all said absolutely not, that the medical system was going to be able to handle it. And that's really important. And I think that most places in the United States, including Florida, that was the initial reason to do the mitigation. And I think there's no question that was something that was handled appropriately. And we thank a lot of the medical professionals for the good work they did. You have anything?
Yeah, how many jobs is this hospital going to bring to Calhoun County?
That's a good question. Do you want to have the CEO in? What do you think? How many jobs, like when this project's done, what will that mean for your payroll? Then I would imagine there'll be jobs in terms of building it too.
Well, we certainly hope to bring on additional services.
Okay.
And to provide additional healthcare services to the community. They'll probably bring initially about 50 additional jobs initially, and then probably go up to maybe 100 additional jobs.
Oh, wow.
In a year or two.
So you're talking about 100 jobs, that's a lot of jobs anyways, but certainly, when you're talking about a rural hospital, that's a really good thing. So, and then obviously you're going to have people being able to put this together. So we're really pleased to be able to do it. And we understand this is a long road back. And one of the things I noticed that after when Hurricane Michael came through, it seemed like everyone for that next week was really fixated. People were bringing food, water, and it was great. But then it was kind of like 2 weeks later, it's like the cameras kind of left, people kind of left. We had our election and for governor, and as we were getting ready to take office, my wife and I were like, why isn't anybody talking about this again? So that was one of the reasons we came here immediately and then went to Washington, because we understand when you're talking about a Category 5 storm and the type of damage that it can do, it's not something that just gets fixed in a month or 6 months. I mean, it really does take a long time. I think the people of this region have been very resilient in the face of a lot of challenges, and so we really appreciate it. I know the First Lady, we were able to announce some money for early learning in Bay County today, and particularly some of the mental health. What you're seeing, some of the things that are going to need to be addressed with mental health because of the fallout from the pandemic, which is, I don't even think we're scratching the surface yet. I mean, this is going to be absolutely catastrophic. We've recognized that that's happening. CDC said up to 25% of people 18 to 24 are having signs of depression. We know young kids in particular, because we saw it in this region, if their school got destroyed and they were displaced or their families, that's a very, very challenging experience. And so the First Lady has been really forward thinking on mental health, but particularly telehealth, so that people are able to get resources easier. And now a lot of that model is being used to help people who are really suffering from the pandemic. And so I think that as difficult as Michael was, I think some of the things that have been done to help build back have put the region in a better situation in terms of dealing with some of these other challenges that we have. So we really appreciate that, and we want to thank the First Lady for all that she's done. So this is not done for us. I always say every time I come, I see some of these guys, like, I think Montfort's here, and George Gaynor and the other one, like usually when they see me in their district, we usually are bringing something. So they usually like when I come, and we're going to keep doing that. I know Dane is, there's more money coming down. I told him, get it out, let's get it. Jared's done a really good job of processing this stuff, but we understand we got to continue to work. And fortunately, we had the Sally, which was bad, but could have probably been worse given the circumstances. We didn't have Isaias, and obviously we're not getting Delta. We're getting towards the end of, if we can get through the next couple weeks, I think the chance of us seeing a storm declines. And so we're kind of crossing our fingers. Jared, there's nothing brewing right now, right?
Now there probably will be.
Well, so knock on wood. But we're still obviously being very diligent. We're monitoring it. But it really would be, I really feel for the Louisiana folks to have to deal with this storm anyways. But then the fact that they had already had to recover from something, I think it wasn't even 2 months ago that storm came by. That's really difficult. And I know Jared and I, as we've watched a number of these storms over the last 2 years, we always look at the different tracks, and any track that comes in this part of Florida, we just say, please. Like, not that we want it to hit anywhere, but you don't want to have the community have to get hit again after being hit very, very hard. So we're here for you guys. We'll be back. I've told Dane, make sure you're out and about, make sure you're talking with all the folks, and when they need something, we want to be there to help respond.